Welcome to the DCH Health System. Visitors to our hospital may park in the south parking deck. The cost is $1 to exit. Parking is free in the open lot across the South Drive. A wide range of support services are available to you and our patients, including case managers, social workers, financial counselors, notary publics, and language translation services, as well as assistance for individuals with visual or hearing impairments. We also have patient representatives available if you have any questions or concerns about the hospital. The cafeteria is located on the main floor of the hospital. The hours of operation are as follows: 1:30 a.m. to 10 a.m. for midnight snack and breakfast, 10:30 a.m. to 3:30 p.m. for lunch, and 4 p.m. to 8 p.m. for dinner. The Sidewalk Cafe is on the main floor around the corner from the gift shop and across from the open patio by the cafeteria. Its hours of operation are 6:30 a.m. to 10 p.m. Monday through Friday. The Sidewalk Cafe serves breakfast pastries, deli snacks and sandwiches, home-baked cookies, and offers Seattle's best coffee, featuring a variety of specialty coffees. Vending machines for sodas and snacks are also on the main floor near the cafeteria and Sidewalk Cafe. Food and drinks are not allowed in patient care areas. This is an infection control issue in the spread of germs and insects. It is also unpleasant for our patients who cannot eat. The Volunteer Auxiliary provides free coffee in the waiting rooms for your convenience. Due to infection control issues, patients are not allowed to receive live plants in the patient care area. Silk arrangements, balloons, and cards are great. If live plants are delivered, they will be given to the family to take home. The gift shop is located on the main floor just by the entrance to the hospital and down the hallway from the chapel. We have excellent chaplain services at DCH Regional Medical Center. Our chaplains are available to offer spiritual and emotional support, as well as to provide counseling for patients and families who need to make important healthcare decisions. If you would like to speak to a chaplain, please inform the nursing staff of your need and we'll be glad to contact them for you. The chapel is located on the main floor below TSICU. It is open and available for your spiritual needs 24 hours a day, 7 days a week. We also have a small multidisciplinary service at 10 a.m. on Wednesday mornings. Alabama state law requires hospitals to inform family members of a deceased patient about the opportunity to donate the gift of life. We have representatives from the Alabama Organ Center available 24 hours a day to answer any questions that you may have. Your family member has just been admitted to the Trauma Surgical Intensive Care Unit, or TSICU. We welcome the opportunity to be of help to you and your family during this stressful time. We are dedicated to providing quality care to you and your family. We all share a common goal. We want to focus on the needs of patients and help them through this crisis period. If you are unsure of the location of your family member, please stop at the front desk and someone will be glad to assist you. We respectfully request that visitors remain with their loved ones while visiting in the TSICU. During shift report and times of crisis, the nurse may pull the curtain, close the door, or ask you to step out for a few moments. We do apologize for any inconvenience this may cause. DCH Regional Medical Center is required to follow the regulations of the Federal Health Insurance Portability and Accountability Act, also known as HIPAA. Because of this, our nurses cannot give information about patients over the telephone. We believe that you have the right to make informed decisions about your medical care. For a summary of your rights, please see the blue Patient and Visitor Information Guide located in each patient room. Also, the doctors will be in touch with you about your family members. Due to surgery schedules, emergencies, and other delays, your doctor may not see you at the same time every day. When you think of a concern or a question, write them down on a notepad for your doctor as a reminder. For the safety of our patients and our family members, we ask that you please do not silence alarms. Leave all valuables at home. The hospital is not responsible for lost or stolen valuables. Do not stand or congregate in hallways. Do not block access to the door or a patient with recliners and chairs. Do not pull chairs and furniture from other rooms. Shoes are required while visiting in the TSICU. DCH Regional Medical Center is a smoke-free facility. There are designated areas for smokers outside the hospital. Absolutely no smoking is allowed inside the hospital. Please be sure to wash your hands before and leaving the patient room. Sinks are located just inside the door of every patient room and on the end of the hallways. You may also use the hand cleaner dispenser in the patient's rooms. Alarms are consistently monitored at several locations on the unit. The staff is trained and prepared to respond appropriately to all alarms. Please do not silence the alarm. Each patient room is equipped with video monitors to enhance patient visibility. We do not video record. There are a limited number of guest rooms available in the DCH Medical Tower for a small fee. For more information, call the number below or contact a patient representative to help you if you have any questions. While visiting in the TSICU, please keep in mind that cell phones can disrupt a patient's rest. We ask that cell phones be used only in the waiting room. Please put your phone on silence or vibrate in consideration of our patients and other family members. The communication center in each room is available for patient information that is updated every shift with your nurse's name, the date, and times of lab draws or x-rays. We ask that visitors be limited to immediate family only and that no more than 2 visitors at a time come into the patient's room. We encourage family input and support for our patients in their care. Visiting hours are customized to meet the needs of each patient. Depending upon the condition of the patient, the nurse may approve an extended visitation for one family member to stay overnight. All visitors are asked to leave at 9 p.m. other than that one visitor. Small children under the age of 14 are discouraged from visiting in the TSICU as it can sometimes be a scary experience. Each patient room is equipped with a colored television for your viewing pleasure. We offer free cable with over 40 channels to choose from. Channels 80 through 85 are educational channels and offer a wide variety of health-related topics. Ask your nurse for more details and further instructions. Your family member will be placed on a heart monitor with an adhesive electrode. This machine allows the staff to observe the activity of a patient's heart. A picture of the heart's rhythm is shown on the monitor above the bed and at the nurse's station. Here, we have a patient's heart rate, blood pressure, respirations, and oxygen saturation. Occasionally, a patient may have difficulty breathing and require help. A soft tube is inserted through the nose or mouth into the airway leading to the lungs. This tube is known as an endotracheal tube or a breathing tube. This tube is then connected to the breathing machine that helps the patient breathe. While this tube is in place, patients cannot speak. They will not be able to eat or drink. Oxygen saturation. This is a small cable placed on the patient's finger or earlobe to record or measure the oxygen level in the patient's blood. A nasogastric tube, also called an NG tube, is placed down the patient's nose, down the back of the throat, and into the stomach. This tube can be used to remove air and stomach contents. The tube can also be used to send nutrition and medications into the stomach. Once placed, this tube does not cause any pain or discomfort for the patient. Shown here is a type of peripheral IV. It is a way of providing necessary fluids, nutritions, and medications to the patients. Some patients require a large IV that goes into the vein close to the heart. This is an IV access that allows the nurse to draw blood samples without sticking the patient for blood. Here we have what's called a sequential compression device, also known as SCDs. This device uses sleeves placed on a patient's legs. Air is used to compress slightly around the legs to help decrease the possibility of blood clots and increase the blood flow to the heart. And finally, shown here is a Foley catheter. This is a small tube placed in the patient's bladder. The tube is connected to a bag and collects urine. In conclusion, we hope your stay on TSICU and also at DCH has been a good one. We appreciate the opportunity to care for you and have certainly hoped to meet your expectations. From all of us here at TSICU, we hope you get well soon and good luck.